Alan Ochanda, KTN.
Even as the government maintains that Kenya remains on a high alert against Ebola, serious loopholes at the Busia border are raising concerns about the country's ability to keep the deadly virus at bay. KTN has established that while screening continues at official entry points, hundreds of people are crossing into Kenya through porous routes without any health checks, exposing the country to a potentially dangerous loophole. Fatma Chidagaya reports.
Fear is taking hold amongst residents who live and tread along the border, where hundreds continue to cross through unofficial routes without undergoing any health screenings. For many, the threat of Ebola no longer feels distant. It feels dangerously close. However, the government insists it's ready and prepared.
Kenya's borders are vital arteries of the East Africa's economy. By embedding these defenses with our Program One Health framework, we ensure that our integrated disease surveillance systems can detect and neutralize threats long before they cross our threshold.
But even as the government moves to reassure Kenyans that robust measures are in place and the situation remains under control, concerns persist on the ground where the reality appears far different from the official narrative.
Kuna passing points mingi sana zenye watu wanatumia kupita. In fact, a few people ndio wanapita kwa custom. So majority yenye watu yafaa wadil nao, hawadil nao.
At the official Busia border crossing, health officers are stationed around the clock, screening travelers and monitoring for signs of infection. Yet, just a few meters away, another border exists, one beyond the reach of scanners, thermometers, and health surveillance. On this bustling market day, hundreds of people stream into Kenya through informal crossing points, commonly known as panya routes, bypassing all health checks and border controls.
Nikibeba mteja kutoka Uganda, kutoka wapi, na muingiza hapa Kenya kama hajapita kwa mpaka, na atapita mlango wa nyuma. Watu wanapita hapa wakienda Nairobi. Wakifika Nairobi, wataambukiza na watu wengine.
These hidden pathways have become an open gateway, allowing unscreened travelers to enter the country unnoticed. Within minutes, many board motorcycles connect to public transport and begin journeys to Nairobi and other major towns. Concern is now rippling far beyond the border. The Kenya Environmental Health and Public Health Practitioners Union is calling for an urgent review of surveillance systems in border counties, warning that current measures may not be enough to prevent a possible outbreak.
We are requesting that if they add 62 officers, that is public health technicians and officers, it will enhance our workforce so that we are able to map up every village, at least 5,000, a population of 5,000, to have at least a public health officer.
Meanwhile, in neighboring Kakamega County, authorities are racing against time to establish emergency isolation facilities and strengthen response mechanism. Health officials insist plans are underway to secure every possible entry route, including water transport corridors along Lake Victoria. But as dusk falls on yet another busy market day in Busia, critical questions linger. Can Kenya truly keep Ebola at bay while hundreds continue to cross its borders unchecked? Fatma Chidagaya, KTN.
Let's move to the Finance Bill 2026. And DCP party leader Rigathi Gachagua has termed President